Hi, it's Dr. Abby here at Radiance Chiropractic, and today I want to talk about how we heal. So we see a lot of kids in our office, and what we used to think is that you had to heal with what's most recently goes away first, and then we work towards older things. And what we found through years of practice is that's completely wrong. So how you have to heal is the same way that you developed. So almost like what got sick first has to heal first. So in utero, you develop first your brain and your spinal cord, your central nervous system. So the nervous system is the foundation of your healing, and that's where this neurologically based chiropractic care comes into play. So we always show parents this pyramid, but the nervous system is first, and if you don't get the right recommendations for the nervous system and the foundation, you cannot build on the healing process from that. So step one is getting here and making sure we have your care spot on using scans to do that. What we tell parents a lot of times, and adults too, is when it's early on in care, you're not going to see the thing you came in for changing first. You have to look for those neurosoft signs. So when we're getting that foundation laid, the changes you're going to see fairly early on in care within the first few months most likely is eating, sleeping, and pooping. Just like a baby. Takes you back to your roots. Okay? So if that is done right, and honestly, that takes kind of the longest amount of time because it's the foundation. You can see the pyramid is wider at the bottom than it is at the top. If that's done right, we can move on to neuromotor. So your neuromotor system is what develops next. In babies, you're going to see those changes with primitive reflexes starting to dissipate. You're going to see them starting to roll and crawl and sit up and walk, okay? So we also have to get back to that for all kids and even adults. So in this part of your care, we're gonna see changes that are really cool with making sure primitive reflexes start to leave. We're gonna see coordination starting to change. We're gonna see even more motility. I know we talked eating and sleeping and pooping, but you're also going to see that the drainage system of the body starts to work better in this part. This is also a great part of your care to incorporate any type of neuromotor therapies. So PT, OT, massage, super awesome. If you start with those things, but you didn't lay the foundation, they're not going to be as successful. So we're all about teaming up with other modalities for your care, but you gotta make sure you get that foundation right before you add those in. And you don't wanna overwhelm the nervous system before we get there. So moving up from there, it's your gut and immune system that develops first. So kids all the time in our office, and adults as well, are coming in with very specific things of digestion's not great, there's constipation, their immune system is terrible, chronic ear infections. And if you look at this and you start to work on, all right, let's eliminate dairy and gluten and see a functional med doc, those things are all important and they're better for your health, but you have to get the nervous system done right first. You can't heal the gut and immune system without getting the nervous system to function where it needs to first. So that's where we're gonna see really cool changes for kids when we get into that point with digestion, allergies, asthma. Did your chiropractic cure it? Absolutely not. But now your body can finally process what needs to happen for those areas. And then the last thing that builds in the very top of the pyramid, it's your brain. So we see a lot of kids in our office for behavior, ADHD, mental health, anxiety, depression, you name it. And brain is the last thing that develops. So those are the symptoms that are usually going to take us the longest. So with that, we see really cool things with behavior and attitude and emotion control and thinking and processing. But if you start with the therapies, the IEPs, the medications, and you didn't build from the bottom, that's a continuous problem of things that aren't going to fix it as much as just mask symptoms. So our goal with kids in our office is to make sure that the foundation is laid correctly, and that's from birth. We're going to scan even the newest of babies and make sure we know exactly what their nervous system is doing with or without symptoms. And we're going to move up the pyramid and follow along with their nervous system as it develops to make sure that we're on the right path and preventing a lot of those issues rather than trying to undo them and go backwards, if at all possible.